Picture this: pharmaceutical scientists at Pfizer are testing a promising new heart medication called sildenafil, designed to treat chest pain by dilating blood vessels around the heart. The drug is showing decent results in animal trials, but when they move to human testing, something very unexpected starts happening that changes everything. In the early 1990s, Pfizer recruited hundreds of middle-aged men for clinical trials of sildenafil in Wales. The drug was supposed to block a protein called PDE5 to help with angina and heart problems. Everything seemed to be going normally until nurses started noticing something peculiar during their routine checkups. A lot of the male test subjects were lying face down on their stomachs and acting extremely embarrassed. But here's where it gets absolutely hilarious. One observant nurse finally reported what she was seeing. The men weren't just shy, they were getting powerful, long-lasting erections that they desperately didn't want anyone to notice. The drug was dilating blood vessels all right, but not the ones around their hearts. It was working on an entirely different part of their anatomy. When researchers tried to collect leftover pills at the end of the trial, participants were mysteriously reluctant to return them. The heart medication was failing at its intended purpose but succeeding spectacularly at something nobody had even considered testing. Pfizer immediately realized they'd stumbled onto something much bigger than a heart drug. In 1998, sildenafil became Viagra and made pharmaceutical history. Ironically, the drug eventually did get approved for heart conditions too, as Revatio for pulmonary arterial hypertension in 2005. So remember, sometimes the best discoveries happen when you re-looking for something completely different and pay attention to the embarrassing side effects.